My name is Mriganka. I am a consultant head and neck surgeon based here at Birmingham. My National Health Service practice is currently based in University Hospitals Birmingham NHS Foundation Trust. This is one of the largest NHS trusts in the country. My private practice is based at BMI Priory Hospital. Once again, it's one of the largest hospitals outside of London. My specialist interests are robotic surgery and thyroid surgery. Robotic surgery has been a passion of mine all through my life. I have practiced the skill for a long time and have acquired significant amount of experience through preliminary via laser surgery, and now with the robotic surgery is more of an extension of a technique. My robotic skills have improved over time. I've learned a lot from different experts. I'm also fortunate enough to start 2 programs in the country. In the previous instance at in Derby Hospital, where I used to work, and now in Birmingham. I probably will be one of the very few consultant surgeons in the country who takes the credit of starting 2 robotic head and neck programs in the country. I believe the robotic surgery plays a significant role in the management of both head and neck and thyroid cancers. Thyroid cancer is one of the fastest growing cancers in the Western world. This is one of the curable cancers, usually affect younger generation. It affects mostly the females, although the cancers are very common in males. They are small cancers. They are, as I said, very curable. The treatment of thyroid cancers is primarily based on surgery. Yes, there is a role of what we call radioactive iodine treatment. However, the surgery which dictates, what is the outcome going to be. Once again, the experience of the thyroid surgeon plays a significant role in the management. More you do, better you get. So therefore, the volume or high volume surgeons always tends to get the best outcome for the patients. What is the role of robotics in the thyroid cancer? There is a role of robotics in thyroid cancer. However, it is only in the select group of patients. And that is something you need to bear in mind. So therefore, the patient selection is one of the most important facets in the management of any cancer management. My other role is management of head and neck cancer. I work in one of the largest tertiary referral centers in the country, and I am the lead robotic surgeon for the unit. I believe transoral robotic surgery will revolutionize the management of early throat cancers. Nowadays, we are under the wings of COVID pandemic. I think something none of us know, that there is a pandemic of what we call HPV-related throat cancers. This will become obsolete in 40 years' time as we are getting people vaccinated, mostly the teenage boys and girls. However, for next 20, 30 years, we'll be managing the impact of human papillomavirus. The human papillomavirus causes tonsil and tongue-based tumors, which is throat cancers, and to a degree, some of the voice box cancers. They usually affect the younger generation, 40-year-old, 50-year-old, and 60-year-old. They're not the patients with smoking history or heavy alcohol, which used to be the common denominator for head and neck cancer patients. These are very fit people. These are people like me in their 40s and 50s who get cancer related to this virus. And the other important facet is this group of cancers respond very well to treatment. And we've realized that the standard of care for head and neck cancer, which was chemotherapy with radiotherapy, has significant side effects. And you imagine yourself, a 40-year-old person, getting a chemoradiotherapy treatment and having a significant side effect. The side effect I'm talking about, dry mouth for rest of your life, swallowing disturbance for rest of your life, voice disturbance for rest of your life. And sometimes, occasionally, you're dependent on tube in your stomach called gastrostomy for rest of your life. You may imagine, you can't taste your wine, your coffees, your food. That is not a great outcome for you. So we nowadays talk about quality of life. And that's where the robotic or transoral robotic surgery comes into play. Because as I said in the beginning, the human papilloma virus related head and neck cancers outcomes very good. So we are trying to de-escalate, i.e. reduce the amount of treatment we give and therefore reduce the impact of radiotherapy and chemotherapy on those individuals. And the way to do it is by doing an upfront surgery, by removing these cancers from the throat, by using minimally invasive techniques such as robotic technique, and therefore reducing the impact or reducing the amount of radiotherapy, and many instances avoiding giving chemotherapy to those patients, and thereby reducing the impact of the side effects from this treatment. Once again, the robotic surgery, I feel, plays a significant role in the management of head and neck and in a select group of thyroid cancer patients. One must remember every single surgical modality, whether it's an open surgery for your head and neck area, your stomach, your chest, etc., does carry some complications. The idea is to minimize them. The way to minimize them is to get yourself treated by somebody who has got significant experience in performing those surgery, has got some long-term figures to discuss with you to see whether those individuals who you're offering the surgery has got the track record in performing the complex minimally invasive surgery. It is important to remember that minimally invasive surgery does not have any scars in your mouth or your neck. And that is the great advantage of minimally invasive surgery. However, these are not without any significant, without any complications. One must bear in mind they will have appropriate counseling prior to surgery. With regards to transoral surgery, the main issue we talk about small risks of bleeding, small risks of significant pain, very small risks of swallowing difficulty. We use appropriate standard protocols learned from our colleagues and my experience over more than a decade. And what we tend to do is use those standard protocols and thereby minimize the impact and complications. The recovery from the minimally invasive technique for both for head and neck and thyroid, one of the greatest advantage of robotic surgery is that the recovery is very, very quick. You get to go home within 2-3 days of the operation. The pain which I'm talking about is a very short-lived pain, usually lasts for 7 to 10 days, and you do not have long-lasting side effects, which is there for radiotherapy treatment, etc. And therefore, this is one of the most popular, facets in the management of head and neck and thyroid cancer treatment. Once again, I re-emphasize, this group of individuals are younger group of people. I'm talking about people in their 30s, 40s, 50s, be it for head and neck, be it for thyroid cancers. And with advent of newer radiology techniques such as ultrasound techniques, we are identifying people's cancer earlier. And what we don't want to do is give them a treatment which has got long-lasting side effects. We want to make sure that we give them the treatment which will not have long-lasting side effects, and we are also not going to give treatment which will compromise the outcome of that individual's care. And the other most important facet one has to remember is that we work in a world where the stuff we do, they are transparent, they are under the wings of a governance process. We always get checked regularly about our techniques, our outcomes. We share the outcomes with our colleagues, the peers, and also with the patients. So that's all in the public domain. So there is no way running away from the fact that, if there is some issues with the technique, this is there available in the public domain. I hope this will help you with your decision-making process and choosing the right and correct and appropriate individual. Thank you very much.